Welcome to Showcase Richmond. I'm Chip Tarkin, and being diagnosed with a brain tumor can be a devastation physically, emotionally, spiritually, and financially, and impacts not only the patient but the entire family. To help people facing this very challenging road is the Cullather Brain Tumor Quality of Life Center. We'll have the touching story on how the center began in a moment. But first, Care Advantage offers compassionate and high-quality home health care for people who are elderly or recovering from surgery or illness. Their segments share the good news of local nonprofit organizations like Cullather. Here's a little more on Care Advantage.
Hi, I'm Debbie Johnston. I'm a registered nurse. I started Care Advantage with the thought of giving excellent care to people in their homes and hospitals. Recently, my own parents needed help. My mom was dying in a hospital bed. My dad recovering from surgery at home. It's impossible to do it alone. My company sent nurses to help make my mom's last hours better and get my dad back on his feet. If you or someone you love needs help, don't do it alone. Call Care Advantage today, 323-9464.
Joining us now is Dr. Sherry Fox. She's the director of the Cullather Brain Tumor Quality of Life Center, and Jack Cullather, whose experiences inspired the center. The center is affiliated with the Bon Secours Cancer Institute. Welcome. Great to have both of you in here. Jack, tell us your family story.
Well, my son was diagnosed with a brain tumor in 1991 while he was a sophomore at VCU. And he fought it for 14 months, passed away in August of 1992. Then, unfortunately, 10 years later, my wife was diagnosed with the same type of tumor. It has not been proven to be hereditary, but as a matter of fact, I had a doctor say we had a better chance of winning a lottery than having a mother's son come up with it. And Jane fought it for 19 months and passed away in 2003.
What made you want to turn all of that great tragedy into something so positive like this?
Well, Chip, what you find when you're dealing with this disease is that, first of all, it's an orphan disease. There's not that many that occur annually. Secondly, the patient generally is seen by a neurosurgeon first, then goes to a radiologist, then an oncologist. Nowhere in that cycle of time does anyone explain to them how their attitudes may change, the physical changes that may take place, both for them and for the caregiver. So, in becoming a caregiver, and specifically with my wife, it dawned on both she and I that we had adjustments to go through and there was no one to turn to. So fortunately, we reached out, got tied in with Bon Secours, and then found this great lady, Dr. Sherry Fox, who at that time was at Charlottesville. And we brought her down here with 30-some years of experience of dealing with brain tumor patients.
Sherry, the center's resources and services are complementary. Why is that so necessary?
Well, brain tumors are absolutely catastrophic, often affect people from the very beginning, affect them mentally, emotionally, and physically, and therefore patients often are not able to work. And so it's very difficult to find resources that they can tap into. So it's very important that they be able to use their financial resources for medications and treatment, and the kind of resources that we have to be complementary.
The resources at Cullather are up on the screen right now, and a lot of these are just so imperative. Folks just don't realize what all you folks do.
Right. Well, one of the things we have two very important things, and that's the personal relationship. I, as an expert nurse in brain tumors, and also my patient advocate, work very closely with families to help them navigate this terrible disease and this journey, helping them anticipate what might happen next along the way, and that's so helpful to know what to plan for. The other thing we have are financial services to help those who are struggling to pay for their medications and their treatments. We provide respite care services because the physical impact is so tremendous. And we also offer some complementary therapies that we call healing vibrations, such as massage.
There's information on the screen. Thank both of you so much for joining us.
Thanks for having us.
Thanks.